It's John with Total Knee Coach, and I'm going to show you the best way to go up and down stairs after knee replacement surgery. Let's say I had my left knee replaced. What I'm going to do is hold on to the rail. Whatever side the rail happens to be on doesn't really matter, because it's going to be on one side going up, it's going to be on the other side coming down. Usually right after surgery you will be using a walker to get around, but we can't use the walker on the stairs. If you have a setup like I have here where there's only a rail on one side and nothing on the other side, what works pretty well is to use a walking stick or a cane in the opposite hand. What I'm going to do is use the walking stick and the rail to help put the pressure off of my left foot, and I'm going to step up with my right leg, my non-operative leg, and use the strength of my good leg to lift me up. This is going to put very minimal pressure on your new knee that just had surgery. Sometimes people talk about going up with the good and down with the bad. While that might be an easy way to remember it and do that and use it if that helps you, we also want to consider that this isn't a bad knee, it's just new and is going to take a little bit of time to get better. Now, when I come back down, I'm just going to automatically switch my walking stick or my cane to the other hand, because you're always going to hold the rail when you're on stairs. And I'm going to lead coming down with my surgical side. So I'm going to use the strength of my right leg, my good leg, to control my lowering down. All that my new leg has to do is just bear the weight. It doesn't have to bend. It doesn't have to try to lift me. And I can go up and down stairs safely. That's the way to do it. Questions or comments, email me, john@totalkneecoach.com.